am I smart enough? Like I felt I had been groomed since I was young to be in science and math. Like, my family really set me up by, they sent me to college preparatory schools and things like that. So I felt like, okay, they set me up for this, but is this really me? Like, can I really do this? And so I feel as if I had to work through that. And also during that time I was very different because I always wore my hair natural. So like I always had afros and I always had like, I was always very expressive. And my name is Nateka. So being a Black woman, I have an afro. My name is Nateka, and I'm very like passionate when I speak, and I'm also very like I love fashion and things like that. So it's like, man, do I fit into these spaces? Like, I was actually voted in like college most likely not to practice pharmacy. So it was like, like, do I fit? And then I would go on interviews. Like I had interviewed for Tylenol for an internship. So I actually worked for Tylenol for some time. And I went on the interview like at the end of my road in pharmacy school, and I was thinking about going to fellowship or residency. And I remember sitting there, and I had my hair like it was natural hair at the time. And I remember interviewing with one of the guys, and he told me, he said, "So you went to Hampton University?" And I said, "Yes." He said, "That's a historically Black college and university." I said, "Yes." He said, "Do you think that has helped you, or do you think it has hindered you?" And I said, "Oh, I think it has helped me." And he said, "I think it has hindered you." He turned his back and continued to do his work and act like I wasn't even in the room. And so that was kind of my first experience interviewing for internships and fellowships. And after that, it really taught me you really have to bet on yourself, because there are going to be people who tell you you don't look the part, you don't act the part, you don't fit into this environment. And that's when it comes no self-doubt. Like you have to know for a fact that this is what you're made for. And I think the second thing that was most challenging for me was just the course, like the scheduling. Literally, a planner was my best friend. Like trying to schedule the tests and trying to keep up. It was like you were at work. Like I would go to school. We were in school from probably 8 to 4. I would take a nap until 6, 7, and I would study from about 8 to 1, 2 in the morning. And that was my routine Monday to Thursday. But Fridays were my happy hours. That was it. That was like my time. So the most challenging part was also keeping a schedule and keeping my up on my center. So those were the two things. And I think as I've matured, the imposter syndrome has settled down because I have worked on myself, and I honestly have, like you said, like believe in me. So whatever you see out here doesn't touch this in here. I'm excellent at my job, and I'm good at my job, and you can't take that from me. And so that actually ended up going away as I've gotten older and I began to truly believe in myself.
I think that the biggest things that stood in my way was myself. I went to art school. I don't know science, so I probably shouldn't do this. The imposter syndrome for me still exists. I was on a shift last night, and I kept running into patients with things that I was like, I don't even know, what am I doing? The difference is now I have no problems looking at a coworker, no matter if it's a PA, an MP, even the nurses. And I don't say even nurses as in a lower standard, just like even somebody that you wouldn't think that a clinician would turn to. You kind of are like, how many times has somebody come practicing and been like, what is this medicine? What is the pharmacology, and then you say stuff, and you have to reach out to others. But for me, I didn't even know what I didn't know. So it was starting from zero, which I think actually kind of helped me because I didn't know how big of a mountain I had to climb. I just knew that I was going to go step by step until I was done. But not appreciating what I had around me, I think was important. I had supportive friends, I had supportive family. I had already had a career. I had money saved. I didn't have to. I did take loans, but I didn't have to because I had spent almost 20 years working on a career, building that up, which I think is huge. I didn't have anybody look at me and say that I didn't look the part. I think that's something that I've never really had to deal with, Mohawk or not. I mean, I don't have to deal with that. And I understand that. You do have to play the game though. I mean, you do have to find your way to play the game. You know, I can't go in with like an old hardcore t-shirt and some torn up jeans and be like, I'm your PA. You know, I'm here to help you. I do know what I'm doing. You have to play their game. But for me, the biggest obstacle was believing that I could do it. I had no reason not to believe I couldn't do it. I had already done something that most people don't do, and that's become a working photographer. So I figured, why doesn't that translate over? It doesn't, but it made sense to me at the time. I think getting out of your own head long enough to realize you got yourself where you are, that was the harder part than where you're going. Because you got up this morning, you put on your shoes, you're all here. That's like the big first step. So there's no reason you can't take the rest of the steps. Yeah, I mean, I have a totally different experience. My obstacles were not real.
Yeah, I mean, here we are all together. So thank you for the thoughtful answers. I really appreciate the openness that we have in the room right now. Just to get a little bit more familiar with like what it is you all do exactly, I'm hoping you guys could tell us a little bit about what a typical day looks like for you.
I'm an occupational therapist, and so I recently transitioned from working in a rehab facility to working in academia. So working in rehab, my typical day was, like I mentioned before, I started at 7 o'clock in the morning. And so the whole goal of inpatient rehab was to work on function towards independence. These patients may have been in a car accident, had severe injuries, spinal cord injury, brain injury, may have had a lot of surgery, but getting them back to being able to get back to their homes, their lives, their jobs, just who they are in general. So my typical day in that setting, and I'm going to talk about both just because I just kind of transitioned into something different, but as an occupational therapist, usually the day starts early if you're going to be an inpatient. I would start and I'd have a couple patients lined up that I was going to do activities of daily living with. So getting them bathed and dressed and just working on those skills towards independence. So working on helping them figure out how they're going to manage that at home. Planning to set up things as if they were going to be at home. What were they going to do to get in and out of the shower? Talking about equipment, planning for that, those types of things, and giving them the opportunity to practice those things on their own as much as possible. Training family in those skills as well. And then have them come in and do the whole, shower, dress, all those things, work on self-feeding with them as well in the morning. And then pretty much went right into treatment sessions. So I have, of the patients in rehab, they get about 90 minutes of therapy of each discipline a day, physical therapy, occupational therapy. So I go right into sessions and I see them maybe work on some other skills towards giving them independence. If they needed to work on function of range of motion, or we needed to work on educating them on equipment or just family education. And then we do cooking activities. And that was pretty much right up until they have, they go break for lunch. They have a little break. I have public meetings. And then come back and we do a little more therapy, and then it's paperwork time. And that's kind of the worst part of the paperwork, I felt like, in that there's always a ton of paperwork in the healthcare field and kind of balancing that out. Sometimes I feel a time lost with the patient or throughout the day, but usually at the end of the day, we're trying for paperwork. The day, typically, even though I work a 7 to 3:30 shift, it typically didn't always end at 3:30 because I had paperwork to do, of course. Families that come in because maybe they work during the day and they wanted to ask a question. So sometimes the family talking with them, doing more education, even just planning. Sometimes we had, I needed to find equipment and I needed to get it ordered and talk to my manager about those things. So the balance throughout the day was difficult, but productivity in that setting is pretty high. So you're pretty much about 100% productive throughout the day. And then you start all over again. First thing in the morning, come back, to do EDLs, conduct daily living. And in between there too, I check out meetings usually around lunchtime, you met with the, what's called a team meeting. So you met with the doctors, the nurses, the case manager, everyone that's involved in that patient care, and we get together and talk about what are the barriers to discharge, how are they doing with everything, and then we talk about, what do we foresee as far as discharge, when can they discharge, how realistically can we discharge in that date, and what do we need to do to get to goal achievement. And then, insurance is a big part of that too. So there's a lot of discussion about, we're not here, we need to get to a certain point of independence. We need to get more time with that patient and start talking strategically about how to work with that with the insurance company to get more time. So there's a lot of things to balance and thinking of, it's in thinking ahead to the next step. In that setting, discharge is pretty much for them, and they come in thinking ahead to what do we need to do to get the client discharged. And I have worked in that setting for, I would say 15 years, I'm sorry. Mostly in inpatient. I've worked in pediatrics, inpatient, and outpatient. I've worked for private practices. And I would say that probably in the inpatient setting today is obviously the most hectic, because you're constantly having new patients coming in. You're constantly trying to work on getting patients set up what they need to have and then discharged. So over the summer, I transitioned to a full-time academic position. So I'm an academic field coordinator now. And I chose to change that position because I wanted to educate therapists. I feel very passionate about what I do, and I wanted to share that, and I wanted to help young therapists see that passion and what a job in OT can look like, and also just help mentor therapists kind of that paying forward that we talked about this morning. Mentor what the possibilities can be. I felt like, I knew that you work with pediatrics, you can work with adults, and I just felt like there were just a couple of things that you guys told you. I didn't really understand all the possibilities that were out there. And I think as the profession's growing too, there is a lot more out there for people to see themselves doing, and a lot more places where OT can fit in. And so I feel like lessons that I'm going to share. And also just mentoring young therapists or young students of color in any healthcare field. I felt like I didn't see any of that when I was going to school. So I felt like that's a spot for me to have some influence as well. So now I help students. I work with occupational therapy students who are in their senior year and in their master's year. But that's for their field work. So those are like their internships. They get to go out to the community, get some exposure to the different settings they can be in, the different patients they'll work with. And I sort of supervise them through that. And then also part of their field work is to have a simulation lab. So this is where they get to practice being a therapist. And this is like a no pressure situation where they get a case, they get a client that they're going to work with, and they go through a session. And this is a place for them to feel safe and just practice what they learn in the clinic or in the classroom, practice some hands-on techniques, and have that no fail. It's not a real client, but they can, if they mess up, we can talk about it, we can figure it out, we can move forward and figure out what went well, what didn't go well, and help them for their next level, which will be the next level of internship. So they go up for 3 months, 2 rotations, 3 months, and they get to actually work with clients on a regular basis, build a caseload, and do supervision of another occupational therapist. So these simulation labs help them prepare for not only just their career down the line, but these next level of rotations. And they, right before they go out again, they get to do another set where they have to go through kind of a full session and then have that feedback from their faculty, the staff that work with them, and so that helps them to feel more comfortable, hopefully, in having experience in learning to talk to patients, learning how to just deal with the unexpected, because that's the way the cases are set up.
So for me, so in specialty, so I'm a specialty rare disease pharmacist, and I want to tell you guys this, you can cut out your own path. So early on, I found that I'm not good at patient facing, I'm not good in the ER. Don't ask me what dose to give right now because I get too nervous. I get too jittery. Like that's not my personality. So I worked at like CVS for a little while. That's not my personality. And then I was a psychiatric pharmacist. I worked in the psychiatric hospital before. That's not my personality. And so I'm like, you know, I like science and math, but I'm learning like I'm not really like clinical based. So I went back to get an MBA. And so I now work in mail order pharmacy. And so what I do is I'm not patient facing at all. I work in a cold store pharmacy is what they call it. So it's now Cigna Healthcare. So basically I only work with rare disease drugs. So drugs for like MS, drugs for like spinal muscular atrophy, all of your rare disorders. And so I make sure that the drugs are packaged properly because my drugs, I work with some of the most expensive drugs probably in the world. My most expensive drug is something called Zolgensma, which is $1.2 million for a vial. And actually that drug is like, it has to be shipped on a plane. The security has to drive it to us. It comes out like a cryogenic box and we have to check it and it has to be out of my hand in 1 hour and driven to the hospital before, not expire, but it has to be given to the baby as soon as they're born for spinal muscular atrophy, because they have found that treating spinal muscular atrophy at birth saves money on the care of spinal muscular atrophy patients. So Zolgensma is one of the drugs, and so I have a host of specialty drugs that I work with that we ship out. So I'm a mail order pharmacist, so I work in like a big Amazon warehouse. But I have freezers, I have two different sides. I have the side of the freezer, cold side, and then I have a dry side. So what I do all day, I have, it's about 25 technicians, it's 6 pharmacists, and then we have packers. So we have stations. So basically, we get orders, they get orders on the screen, they pull them from where they come from, whether dry or cold, whether it's a cancer drug, whether it's a drug for cystic fibrosis. I check it to make sure it's right and make sure it's packed properly. Because some of the drugs have to be packed on dry ice, or some of the drugs have to be packed to make sure it gets to the patient like it's supposed to. So basically, I'm in supply chain. Absolutely love it. I make sure that the drugs. So I service around 4,000 to 5,000 patients a day. So my day starts around 7:30, 8 o'clock. We open at 8, but most of the time we get there early because our volume is increasing. I actually created my own schedule, and me and my manager have a great relationship. So I work 4 10-hour days. So I work 8 to 6:30 Monday through Wednesday, and then Thursdays I work 7 to 5:30, and I'm off Friday, Saturday, Sunday. And so that's the best schedule for me because I understand that I'm whimsical, I like to travel, things like that. So I had to carve my career around the type of person that I am. And so just because you are in a science and health field, doesn't mean you always have to be patient facing. It doesn't mean that you always have to, do what everyone else is doing. You have to learn yourself and carve out your path. And so for me, I absolutely love my job. I go in and I can listen to music while I'm at work. Because usually, I'm kind of like working on myself. And then we actually service, like I said, 4,000 to 5,000 patients a day, upwards to 25,000 patients a week. So we're open from 8 to 8:30 p.m. And so we have different shifts of pharmacists. So some work 12 to 8:30, and then some work 8 to 4:30. But the thing about that is our shifts can rotate. We kind of can create our own schedule, because it's not like hospital-based. We're closed on Saturdays. We're closed on holidays, so I don't work holidays. And we are open Sunday through Friday. And so that is the best thing for me. But also, I love the drugs and I love the people that I get to service, because I feel like in my industry, these are diseases that you don't really think of. You don't, the patients that I treat, like I have patients who are blind, like I never get to see them, but like I have a drug that sees something called sleep-wake disorder. I've never heard of it. Basically, people who are blind can't tell the difference between night and day, so their circadian rhythm is off. So I have a drug that actually makes sure that it's fine so they can sleep and understand the difference between day and night. So I may not be patient-facing, but the patients that I service, I have to make sure I'm there, whether it's a snowstorm, snowstorms don't bother us. Weather doesn't bother us because the patients that I service are very critical patients. and they need their drug. But I'm just on the other side, so you never see me, you just see your product. But I'm very passionate and I, love what I do.
I feel like seeing 35 patients in shifts seems pretty lame now. So I work mostly in urgent care with shifts in emergency medicine as well. I have no idea how my day is going to go until it's already over. Whatever walks in is what walks in. We see, in the urgent care that I work in, we see newborns to, the oldest patient I've seen was 104. I've seen 3-day-olds, not in the same shift, but I mean, we see a wide variety of people. We see people that shouldn't be in urgent care, that should just be following with their primary care doctor if they don't have one. We see a lot of people who should go to the emergency room that don't, either for financial reasons or fear, or feel like it's not that big of a deal if they're having chest pain, sweaty, and can't breathe. In the ER, same thing. We see all comers, whether you have money, insurance, or don't, whether you stub your toe or you have, something poking out of your head that wasn't there in the morning. I don't know how many people I'm going to see. I don't know how stressful my day is. I don't know whether I'm going to have to tell somebody they have cancer or whether I'm going to tell them, hey, this isn't cancer, you have a bug bite. I mean, it's as simple as that. I don't know until I see you, until I get results. Or I do like being patient-facing. I don't always like patients. Because between people, their fear, their misunderstanding, their disbelief in medicine, which is new since I've been a PA. I mean, in 5-6 years, it's gone from, whatever you say, nobody understands what a PA is, which I'll go over really quick here. People always say, well, you're the doctor, whatever you say. And it's like, now people argue, well, that's not what I read. Okay, well, one of us went to school for this. I don't know what I can say to you. Do you guys know what a PA is, what a physician assistant does? So we are the medical side of a nurse practitioner. Nurse practitioners go through nursing school. They have a nursing mentality and nursing training, which is different than medicine, than doctor-based training. In the urgent care, there's nothing that I do, no patient that I see that a doctor sees any differently. We all see the same people. There are shifts where I don't work with doctors. Every state is different with legislation and regulation. In Pennsylvania, I just have to be able to reach a supervising doctor if I need them. I don't always need them. I may go weeks of shifts without making a phone call or asking a doctor's opinion. In the ER, it's totally different. Most of the time, because I work at Hershey, it's an academic place, you have to run anything, really anything of any value past the attendants to make sure we don't screw up. It's a combination of good and bad. But I see people, I take histories, I treat, I perform procedures, I interpret labs, order labs, discharge patients. Yeah, so for me, each day is different, which is really what I wanted. I didn't want a routine of, I'm going to see this many people today and I know what's coming. That drives me crazy. I like to have the surprise most of the time. But I think being a PA fit me really well because I am a little scattered at times. Like I like a little bit of the chaos of, okay, you've got this person in this room, you're waiting on x-rays, this person, you're still waiting on a CT scan or something, this person, you're going to go in there and sew them up or cut something out or drain something or pull something out of an orifice. It's not supposed to be. Like, I like the slightly organized chaos that is medicine. So I show up, urgent care, most of our shifts, I work 3/12s. That's a normal week in urgent care, which is great, except you don't always choose it. We are open 364 days a year, so you work holidays. In the ER, it doesn't stop. There's no there's no closed day for the ER. We also have a saying, everybody's already heard, every stuff runs downhill. The ER is the bottom of the hill. That is the last edge of the safety net. So you have people come in that are medical train wrecks. You have people that abuse the system, but you still have to treat them the same way. And sometimes it's hard because they say or act or do things that make you want to smack them. But I always try to remember that it's my Tuesday, it's their bad day. You know, they're coming to me for help. I gotta leave my stuff at the door because they can't. That I actually need to go back and say that's something that's harder to do than I expected. You know, when somebody's yelling at you, telling you that you're lying to them about what's happening, you know, part of you wants to get defensive and be like, believe it or don't believe that's what's happening, but you have to be able to approach somebody at their level, which isn't always, especially with varying levels of understanding of what healthcare is and people's own understanding. I mean, some people don't even know what to call parts of the body. Literally have no idea what the term is. So, but I love being a PA. I can't imagine being a doctor. I get a kick when people say you're going to be a good doctor one day because they don't understand that this is where I am. They think physician assistant, that I'm trying to be a physician. So I take it as a compliment when somebody says that I'm going to be a good doctor one day. And I tell them, no, I'm not.
Yeah, thanks for that. We're actually going to open it up to the audience and let you guys ask whatever questions you may have for our panelists.
I know that you all sort of touched on it with like travel and everything, but I was wondering how you sort of balance your work self versus like your home self, in the sense of like, especially towards the beginning of your career, you're like, you might have a bad day where you didn't answer a question right to your supervisor, or you might not feel smart on that given day. Like, how do you go home and not tie your self-worth and like your personality to your job?
You know, I'm glad you brought that up, because that was actually one of my biggest challenges. I remember the first time I came out of school and I sent out a wrong prescription, like something wrong. Number one, it's going to happen in your career. You're going to do something wrong. I literally was decapitated for like 2 days. I cried and I cried and I called literally I turned into a little girl again. I called my mom and I'm like, Mom, I don't think I'm cut out for this. Like, how did I do this? And it's like, as you move through your career, you become more resilient, but you cannot gain that resilience unless you go through those things. So I think the first time that it happened, it was absolutely devastating. Like, I didn't want to go back to work. I felt like I was inadequate. I felt like, oh my goodness, like, I don't think I could do this. Like, am I not smart? Like this is completely wrong. But I think it's a natural part of life. Like, whether it's your career, whether it's in your relationship, you will learn as you move through life. There are going to be things that are not going to go right, period. And you have to build up that resilience in yourself. And I think that's where the belief comes in to yourself. You have to believe, like, this mistake isn't a representative of who I am. It was just a mistake. And so it went into changing your mindset. So you have to be mentally strong. But I will say, you get there. For me, it took me, I had to get there along the way. And I've made multiple mistakes after that. But within that, I learned how to mentally just rebuild myself up. I had to talk to myself, like, okay, it's a mistake. Everyone makes a mistake, you know. It's not deadly, and that's one thing he said is pray. Like, I don't know what you believe in, but maybe I just pray, like, okay, because it could be deadly. I'm in a career field. Well, one mistake, one wrong decimal point, I can kill you like that. So it's always just guidance because I can, but it's just the mental resilience.
And you definitely learn to have thick skin in this career. I can remember early on, just I had a patient and I didn't know the full course of action of what I was supposed to do. And it wasn't that I did anything wrong, there was something further that I probably should have done, but being a new therapist, I didn't know that. And so when someone came to me and said, well, why didn't you do this? And I was like, well, I didn't know. But learning to seek out help too, I think helps. And I think I struggle with that too, because I felt like I got out of school and felt like, well, I'm supposed to know all this. I learned all this, and I went through all my internships, but learning to ask for help. And sometimes you don't know, and but seeking out a good mentor helps with that too. to help with the checks and balances of things. But I think also allowing yourself to make mistakes, and you're going to make them, and it's, and sometimes they're grand mistakes, and, you take responsibility and you ask for help and you do what you can to make it right. And sometimes they're little mistakes and you don't have to like report it to everybody, just say, okay, what can I do to fix it? And also just like, she talked about having resilience. You start to build that over time, like when talking about, patients yelling at you, because they're not themselves. They're in a bad place at that time. And so having to understand that, and it took me a little bit to be able to remember that, because I feel like I was taking it very personally for a long time. When they're angry about their diagnosis, they're angry about what's happening with their life. But I get to go home and, do what I want tonight, have pizza, watch TV, talk to my family. But there's stuff in the hospital dealing with this. And so just remembering that, and you learn to also sort of, in those situations, be able to relate to patients and reach out to them and help them along the way too. And it gets easier, but I think also just having good support, people to talk to. I would get on the phone and be crying and say, I messed up today, and people that believe in you and can help you believe in yourself too.
I failed miserably at it for a while. Before I went to PA school, I was a decent runner. Marathons, half marathons, I enjoyed running. When I got to PA school, several people, including the program, everybody was like, don't, whatever you do, don't. And if you don't do it now, start doing something. Have a hobby, have a way to depressurize. And so I started running. I kept running, I should say, and then it just felt like it was cutting into studying, and I just wasn't able to cope. And so I was like, all right, I don't have time to run, which I regret from both a physical standpoint and a mental health standpoint. I have a buddy who is kind of a hero, but I also just want to choke him sometimes because he doesn't know how to have doubt. It doesn't exist in his brain. Throughout PA school, he continued to train and became a world-ranked triathlete. Meanwhile, I'm like not even running anymore. Like I'm just trying to get through my day. Ronnie's like crushing records, and I just, the difference is he never took his foot off the gas for himself. I took my foot off the gas for myself and tried to put it into school. You have to have, if I had just run 15, 20 minutes, like a fraction of what I was used to, that would have been huge for me. As now I run, I have hobbies. Like you gotta have a hobby. You gotta have something that is not work related. You gotta have friends outside of work. I don't know how you guys feel about that, but like when you talk to friends that you work with, all of a sudden all you're talking about is work again. You're swapping stories about patients and stuff like that. You gotta have a way outside of where you are. Otherwise I feel like it consumes you. I also have a kid. I don't know if you guys have kids, but that's why I can't travel anymore. So I'm jealous of her. It's not true. It's not 100% true. But seeing somebody else experience life in a way is kind of mind blowing. But I have a couple of outlets that I focus on. Sports. I like archery. I run. Woodworking. Like I find myself like looking for new things to do because I want to do more besides medicine. But you have to focus on your craft, otherwise, you're in the wrong business.
Yeah, that's cool. I want to just say, just own the mistake, but don't let it own you.
Absolutely.
That's it. Just own the mistake. Own up to them. You're going to make them own up to it. Do not let it own you, though.
And never hide it.
Yeah. Don't
try and hide it. That's way worse than committing the mistake. Walking up, I would say, one thing that I do with patients is I treat patients. I do my best. I walk in. How would I want somebody to talk to me? I want somebody, like I tell people from the beginning, this is going to hurt. I don't do that. This is going to pinch. I don't do that with kids. I tell them the truth. This is how it's going to go. But if you make a mistake, people are ready to accept that you made a mistake. People don't expect you to be perfect, even in medicine. But if you try and fake it and they find out, where they realize it, you've lost all connection with that patient. They're done with you. They're not buying into your treatment plan. They're not buying into anything that you say. You're now some jackass that tried to lie to them. So like, I made a mistake, I screwed this up, you know. And my last thing on that is, in my area, there's layers between me and some of my mistakes. The nurse will come up and be like, hey, idiot, did you mean 10 milligrams of Dilaudid? Because I think you're gonna kill everybody in the room. Yeah, oh, no, 0.1, yeah, the decimal place matters. I have people that are there to help prevent me, but you will still make these mistakes, and you gotta say, like, that's on me, that's mine, I'm sorry. How can we move forward?
I think everyone just in this field is so willing to help, and it's like David said, there's a lot of layers between. If someone catches it, they're not going to be like, oh, you're done, you're a terrible person, you're a terrible practitioner, you know, just what can I do? Is this right? Just double checking. And I've experienced where, you know, I forgot something, you know, or with a patient and have to go back in and say, oh my gosh, I forgot to give you this, or I forgot to say this or that. And they're always, oh, that's okay, you know, they're most of the time very forgiving, very grateful for you coming back or you telling them that.
Oh, I'm sorry.
No.
Thank you so much for being here. I just wanted you guys to like go over like the process of getting to like let's say pharmacy school or like PA school and like your experience like doing the courses and how rigorous it was and like what your experience was like being in those classes.
So I did something called a direct entry program. So right out of high school, I signed on to go into pharmacy school, but I had to make a contract or a vow that I would keep a 3.0 GPA and get no seat. So that meant that if I did that, I did 2 years of undergrad instead of 4. So I did 2 years undergrad, 4 years of pharmacy school, so I cut out 2 years. But I was not allowed to get a C. If I got a C, I was kicked out of the program. So, and I took 18 credits every single semester. So, but what I did do though, which was smart, and I would recommend this, I took medicinal chemistry in the summertime. I just sacrificed my summer and took that by itself. So that's how I got there. I didn't want to take physics, medicinal, all that together. I decided that I was just going to sacrifice one summer because I heard medicinal chemistry was the hardest thing ever. And I said, okay, I'm not going to do that with the rest of my classes. I'll just take it in the summer by itself and pay the extra money and pass it. And so that's what I did. I took it at a local like community college or college where I was outside of my school and just transferred it in.
I actually, I went into college when I was in high school. I'm not sure exactly what healthcare field I wanted to go into, so I did a lot of shadowing, talking with other healthcare practitioners. I'm not being a PA, I'm not being a PC, and so I did a lot of shadowing. And then once I kind of got to where I figured out what I wanted to do, transferred into a program which was actually a 5-year master's program. So pretty much you were already accepted into your master's program as long as you kept up your GPA, passed everything. And so then it was my bachelor's in allied health science, and then the next year we did our internships, did our research projects, and graduated with a master's. And then my doctorate, I went for a post-professional program, so this is for therapists who have already been out working in the field for at least a few years, and that was 16 months. It was pretty fast-tracked. It was actually kind of full-time and also working full-time. So the entire time you're working on your capstone project, which is your research, and then taking classes, everything around that. So that was a little bit hectic, but I love that every class that you took related back to your project that you had chosen to work on.
I also forgot to say, I eliminated the PCAT. I didn't have to take the PCAT because I did direct entry. So I did not have to take the PCAT because I signed on. But if I would have failed any of the classes, I would have had to go back. But I didn't have to take the PCAT.
Like I said, I went to art school and everything first. So thankfully, I was able to transfer, like a lot of my undergraduate stuff applied to some of the prereqs for PA school. The stuff I didn't have was the stuff that I needed to go back and do all the STEM, basically all the engineering, but all the science and math. I did that at a local university in Brooklyn, Medgar Evers College, and the PA schools all, I think they all do now, are part of CASPA, Central Application, I don't know what the S part is, Central Application for Schools of Physicians, whatever it is. And you have to put in this, you have to put these things in, and you apply to different schools, and the schools have rolling admissions. So it's one application to get into almost all the schools. And then you'll get an interview or you won't get an interview based on your application, but it's a standard application for most schools. Basically, meet these requirements, you get a chance to come in. But PA school, I don't think any PA school is different as far as minimum 3.0 to graduate. Most schools will not let you, if you fail, you have to reapply. Like it's an in, stay in, or we're done.
Last question.
Okay, I was just wondering, it seems like all of you have like a sort of education path change or career change or like kind of discipline change. And I think I'm anticipating that in a way. So I'm just wondering what that kind of looked like and felt like, and maybe some worries that you had to overcome and how you went about that process.
I think you said the number one, well, you just kind of say to yourself what that felt like.
Mm-hmm.
That is what you have to go on. When I quit my job after I went to pharmacy school and was practicing for 2 years, my mother, my father, my family was like, what are you doing? And at this point, I had to push back and say, I've done everything that you guys set me up to do. Now I want to live my life on my own terms. So you have to do what feels right for you. Life is gonna life. I'm just be honest with you. Life is gonna life. There's gonna be things that are gonna come up. The only thing that you can control is you and how you feel. Go on that, because people are gonna say things. There are gonna be things that happen in life that are so unpredictable. You have to do what's best for you. And if I could tell you anything right now, grasp onto that. People are gonna say things, tell you not to do what to do, but early on, I took responsibility for my rewards and my consequences because I made those choices. So I think for me, I just became fully responsible for myself. And with that, if I mess up, I have to eat that. I have to take that. If I get a reward, I take that too because this is my decision, no one else's. So, and I felt my way through.
Yeah, I agree with that. It has to be what you feel is best for you. I knew that there were a lot of things that I wanted to explore. And so I went from working in pediatrics to working in schools. So I worked in an outpatient and school system, and I just wanted to be able to explore a lot of things and figure out what I liked, but I always knew that I was going to probably end up in education. And for me to leave patient care, people think that was crazy too, but even just all the jumps that I made in my career. And I'm still kind of, sometimes I'm like, that stings a little bit. But I also felt like I needed to do that for myself. And I felt like that was a passion that I had and I wanted to explore it. And sometimes too, things don't work out the way you expect them to. And that's okay too. But it's your career and you want to do what you're passionate about.
I think, the common thing here would be resilience, but also knowing when it's no longer right and being open to that realizing the path that you chose at some point is no longer correct is not a failure. It's a win that you realize that is incorrect for you, because we've all worked with people that just stuck with a path and they are miserable. They suck at their jobs. Yeah. They're terrible to be around. They're awful. Mm-hmm. And I have pity for them. There are a few people I truly pity, and I pity people that have allowed themselves to fall into that. Yep. So I remember from your PT? OT. Mm-hmm. Sorry.
That's okay.
But if you decide at some point, you're like, this isn't for me. I want to do pharmacy. Like, that is a win for you, that you've decided, like, that is no longer for me. And I realized that photo, as much as I loved it, I wasn't getting what I wanted out of it anymore. And I needed something else. And I knew that there were things that I could do beyond that. And when I found medicine, I tried to find a path that made that goal of feeling like I've done something appropriate and beneficial to the world. That came for me. And I expect, one of the reasons I chose PA, honestly, over MD or anything else is, as a PA, I can change fields, right? If you know, as I said, I loved OB-GYN. If an opportunity came and I was accepted, I can go into OB-GYN, and I trained in that direction, but I don't have to reboard. So I wanted a career path that allowed me that flexibility of, that's not working for me anymore, I'm going to go over here. I don't expect to stay in ER. I mean, that chews people up. You know, I expect to leave it at some point. But I have that flexibility. And I may, you know, I mean, I'm not stupid. I may leave PA. I have no idea. You know, I could end up in research. I could end up in academia. I could go back to photography. I could end up being a chef. I have no idea. But I don't hold that as a failure, because I did it. I already got my degree. I got my license. Like nothing stopped me there. So you could even just be like, all right, I did that. What's next? So.
Thank you.
Yeah.
What I needed to hear.
So that's going to be it for our session here today. So thank you so much.
I would say that, I don't know how you guys feel about this. I'm not going to speak for me. I have no problems giving my email out to people if somebody has more questions. Feel free to find me, ask me. That's fine. I don't have to try.
Yeah,